my name's Peyton Burke, and I'm a University of South Alabama nursing student. And today I'm going to be performing my nasogastric insertion checkoff. So I'm going to be demonstrating 3 different skills for you today. And normally I would have already entered the room, introduced myself to the patient, performed hand hygiene, identified them using 2 markers, identified any allergies on the patient through the MAR, and then I would have just explain the procedure to the patient, make sure that they know what's going to be going on, and then I would provide for privacy for the patient, raise their bed up to a good working height, lower a side rail, perform hand hygiene again, and then don my clean gloves, lay out all my contents for the procedure, and then I would begin. So I've already done all of that, and so the first thing that I'm going to be demonstrating today is how to measure a nasogastric tube for placement upon insertion. So I would do this in a clinical setting on a patient. I do not have a patient or volunteer here with me today, so I'm going to demonstrate how to properly measure that on myself. And this would also be done underneath the patient's clothing, but we are not going to do that today either. So I'm going to pick up my nasogastric tube, and I have my goggles on, but I'm going to just move them out of the way so that you can see what I'm doing. So I'm going to be using the distal end of my nasogastric tube, and after I occlude both nostrils, make sure that they are clear, I would clean the bridge of the nose with a alcohol swab, and then I'm going to place the distal end against one of the nares and measure from there to the earlobe. And then after that, I would take this part of the tubing and pull it down to the xiphoid process, and I would palpate the xiphoid process and hold that as a marker. So now that I have this marker, I am going to just clamp it off with a piece, or not clamp it off, but mark it with a piece of tape using like a dog ear method so that it's easy to remove upon insertion to my patient. So once I've done that, I'm now going to demonstrate how I would aspirate for any gastric contents from the NG tube. So I'm just going to set this up for you. I would usually have one piece of tape holding the NG tube onto the patient's cheek. Like that. And so now I would have a basin, and I would get a 60 cc syringe, and I'm going to use the proximal end of the tubing, and I would just insert the syringe into the proximal end, and I would hold this over a basin and just aspirate for any gastric contents. So that's a way to make sure that the NG tube is in the correct spot and it has the correct placement. You can also do that through radiography or pH test paper, but this is one way to do that after you look in their mouth with a tongue blade and a pen light to make sure that it's in there correctly. So that's one of the skills, and then the other one we would demonstrate today is just showing that this part of the NG tube would be hooked up to oxygen on the wall if we were suctioning, and this blue dog tail would always be above the patient's stomach. And if we were not suctioning, we could go ahead and clamp it off like this. So that completes my nasogastric checkoff.